Good morning, everybody. I am so excited to be here. I'm really excited. I come from the communities of Terrace, Thornhill, and Kitsillis, and I loved my practicum. I absolutely was honored to be placed again with the Ministry of Health in the Healthy Living Health Promotion branch. And I had the opportunity to witness the transition from Health Canada to the First Nations Health Authority, of whom I work for now in their community engagement department. So I've really watched that transition and been placed in some very key roles. And then this project was almost a continuation of that, in that the Ministry of Health and the regional health authorities are looking to partner with the First Nations Health Authority. So what I focused on was enhancing the Healthy Families BC Communities Initiative in First Nations communities. And what that is the Healthy Families BC is the province's health promotion plan. One of those goals is the Communities Initiative, which works on acting on the community setting. And the key player in that is local government or municipalities. So the purpose of the project that I worked on was to assist the Ministry of Health and the regional health authorities in identifying how they can best support First Nations communities. The components of this were presentations that I made to the regional health authority leads. So these are the people who are responsible within each of the health authorities to deliver the Communities Initiative, as well as my director, Winnie Yu, who is the director for physical activity and healthy settings. And after that, I moved on to a document scan between the Ministry of Health and the First Nations Health Authority. And I'll explain a little bit of that later. And then finally, which was my favorite part of the practicum, was conducting meetings between the regional health authority leads and myself. And I went region by region. And it was conducted over those lovely teleconferences that we know and love. But it ended up being fantastic anyway, just because I love people. So great. Okay, so the presentations really focused on teaching the regional health authorities about our community engagement structure, which I'm one of the cogs in that wheel. The point of that being that we want First Nations voice. We want not just what their priorities are, but we want to know how they want to shape services. And not only services, but large areas like the social determinants of health, which I'll talk a little bit about that later. But that community engagement structure is very much linked to our new health governance structure. That involves chiefs, health directors, and any key community leaders within the First Nations communities. The second presentation that I made to the regional leads was to do with the First Nations Health Authority regional health and wellness plans. That's pretty similar to the Healthy Families BC, but for First Nations. And that not only encompasses health promotion, but primary care and mental health. But it really was about helping them understand who to connect with in the First Nations Health Authority, and the key components which they weren't necessarily familiar with, because the health and wellness plans really, for now, focus on access to primary care, improving primary care, and so their counterparts within their own regions are the ones who really are connecting with First Nations communities right now, not necessarily the health promotion staff within the regional health authorities. The document scan, even though it was really dry at times, it was really important because it really gives us the legitimate springboard from which to start partnering between FNHA, the Ministry of Health, and the health authorities. So the similarity between the two documents, and I say two documents because each of the health and wellness plans are roughly similar between regions. I don't know if you're familiar with this, but FNHA's boundaries, we're broken down into 5 regions similar to the regional health authority. So we follow the same boundaries so that we can easily plan between each other, and that was going to happen from FNHA's inception. Both of these documents recognize that it's important to partner. We will partner on anything and everything to do with health. So those are found within both of the plans. The policy framework for HFBC, its main focus for the Communities Initiative is on building healthy public policy. That's its business. It has 7 distinct intervention streams. I won't go into those. It's geared towards municipality functions, however. So jumping on to the health and wellness plans, those are really, again, as I said, built from the First Nations communities' priorities, whatever those are. The first directive of FNHA is to be nation-based and community-driven. And that's the intent of these plans. What also follows these plans is regional funding. So whatever those priorities happen to be, funding follows that to support it. The partners within that plan are the health authorities themselves. They're signatories to those plans. The chiefs are signatories to those plans, and the First Nations Health Authority, the relevant staff, are also signatories to those plans. It also outlines how First Nations want to be engaged, so this is a very good indicator to the HFBC staff about where to go from here. The teleconferences that I conducted were really about finding out what the current context of the delivery of the Communities Initiative in each of the regions is right now. Not just to do with First Nations communities, but in general, overall. And just for you to get a sense of what that's like, there's about 1.5 FTE, so full-time employed staff, that are responsible for delivering the Communities Initiative. In the North region, that's 33 municipalities. If this was to expand to the First Nations communities, there's 34 other communities on top of that 1.5 people need to make this happen with. So one of the gaps is, yes, understaffed. The other that was noted was the reporting structure. It doesn't necessarily reflect the level of work that's happening right now, which is fairly high quality, depending on what mechanisms the First Nations communities use. The tools and resources of the Healthy Families BC Communities Initiative don't necessarily reflect the context of First Nations communities. And I think one important point for you to understand is that a municipality has a lot of flexibility with how they move their funding around. They have a lot of autonomy about the decisions that they make for their community. This is not the same for First Nations communities. You're given funding and then you're told to follow certain rules and then you get the funding. So the other is that First Nations band councils are responsible not just for zoning and infrastructure, but they're also responsible for education and probably for treaty and all these other things. So I would just want to skip to the supports required really follows the recommendations that I made. So what needs to happen now are planning discussions. The high-level documents that support partnering don't necessarily give the Healthy Families BC Communities Initiative staff the direction necessary to partner formally with FNHA and how that works. Those planning discussions are going to decide where resources go, what staff are going to do, and I really appreciate and probably want to end with the amount of humility that I encountered with each of the regional leads. They understand a lot of what they don't. And it took a lot of courage to say, we don't know. We don't know what we're doing. We need help. And we really want to know more about First Nations communities because we realize it's a completely other world. And so some of the strengths and the limitations of this project was the learning that took place between each of the regional leads. They started to understand how each of them delivers things, but they also were able to ask me questions about FNHA because I work there, in terms of what might be termed a silly question, and we could just have that conversation right then and there. What supported my practicum was that I wasn't just coming at this as a practicum student. That really sort of leveled the playing field, and they were really engaged about making sure that they made time for me because this was going to help them in the end. So the limitation was I did all of this from my apartment. So I wasn't necessarily able to connect face-to-face with them, but it was fine. And I am done. All right. Okay. That's it. Oh! I was totally going up the other slide. Oh, that's hilarious. I was always one slide behind. Oh, that's sad. Anyway, questions?
Questions. Oh, there we go.
Thank you for that. That was really interesting. I heard you say at one point nation-based, community-driven, which I thought was, I hadn't heard that before, and I thought that was a really great way to put that. I was just wondering how you think we can fully kind of live up to that when communities are not autonomous with their funding.
Within that context, we augment it with the priorities that they outline in the health and wellness plans themselves. So that funding is completely outside their contribution agreements within their health departments, and it goes beyond just services and programs. And the regional envelope funding, which is what we call it, for now focuses on primary care mental health. But in the next wave of plans, because these are living documents, we're seeing a lot more emphasis on the social determinants of health, and looking at those larger systemic issues, which those plans have the ability to focus outside those agreements. Yeah.
I've got a question for, you seem to be so relieved that you're done. If you were to start again, what would you do differently? Or is there anything you do differently?
Was there anything I would do differently? I think it was probably a strength and a limitation that I know so much about FNHA because I was so quick to try to jump to solutions. That was one of Winnie's recommendations to me, was Coco has a hard time focusing on sequential steps and really paying attention to laying the foundation, which I was able to dial back my excitement. And I think that probably would be the thing that I would not necessarily do differently, but Winnie was such a good counterpart to my personality. And so she was able to sort of augment where I kind of went nuts.
All right, well, that's an interesting response. Thank you very much. That's
Thank
great.
you.